We're not prepared for COVID. We are learning a lot from COVID, but we've got to also now build pandemic memory. In other words, just like human immune systems, which once infected, build memory of the infection in order to counter it the next time. We've got to build memory and keep memory of the pandemic in order to respond much more robustly and much swifter to the next pandemic. And we are far from it today. We're still very far from equipped with the capacities and the reflexes to prevent the next pandemic. And our report, by a panel that comprises former finance ministers, former central bank governors, many other experts, sets out what we believe is a workable set of measures that the global community has to take, affordable, in order to head off the risks of coming pandemics, even as we tackle today's pandemic. We don't have the luxury of waiting for COVID to be over before we start preparing for the next pandemic, because the next pandemic can come anytime. If you talk to the scientists, it might be in 20 years' time, and maybe 10 years' time, or it could be next year. It could come anytime. So we've got to use our current efforts to tackle COVID to also build up the capacities required to head off the next pandemic.
And what needs to be done in concrete steps?
Right. So specifically, it means moving away from a system of providing finance on a bilateral basis to individual countries or to specific organizations for specific diseases, towards investing collectively in global public goods. Global public goods are things that benefit all countries. It's not about aid to a particular developing country, for instance. It's about investing collectively in a way that benefits all of us. It means, first of all, better and more reliable funding for the WHO, which is dependent very largely on bilateral contributions right now. It means making much better use of the World Bank, the other multilateral development banks, and the IMF. They are unique institutions. They are multilateral institutions that are able to catalyze other resources besides shareholder resources. And they are able to work together with national governments to ensure that investments are put into place that benefit those countries, but also benefit the global community. And that's the essence of global public goods. So make much more use of this unique set of institutions, the World Bank, the multilateral development banks, and the IMF. But thirdly, beyond funding the WHO, beyond using the international financial institutions, we do need a new global funding and governance mechanism. It's lacking in the system. That global capacity is lacking. So the whole system is fragmented. And as a result of fragmentation, it's underfunded and there are big gaps in the system. So we need to set up a new global fund, which we estimate as being minimally $10 billion a year. 10 billion sounds like a large figure. It's actually very, very small. As a percentage of national government budgets, the countries that will contribute to the fund, it's about 1,000th an annual budget for each country. But it's extremely important to have that common multilateral layer of funding in order to move in a much more responsive way to plug the gaps in the system and not just rely on individual institutions' ability to do so. You need that layer of multilateral capability to plug the gaps. And you need governance for it. And what's lacking today in the global system, you've got health governance under the World Health Assembly and the WHO. You don't have a system that brings finance together with health. There's no system that brings finance ministers together with health ministers on some collective basis. And that's why the system is underfunded. It reacts after the event, after a crisis is broken up, and we are unable to proactively head off future crises.
But wouldn't you also say that we need more open cooperation on an international level? Because this crisis has shown that if we had not covered up the start of Corona, then perhaps the rest of the world would have understood a lot better what threat comes out of that. So what can we do collectively to ensure that we trust each other a lot more?
So there are three key priorities that require this collective funding. The first is a global surveillance system, an early warning system, which has to be national, regional, and global, detecting as quickly as possible these spillovers of viruses and pathogens from animal life into human populations, doing the genome sequencing very quickly and sending alerts to every country. so that they can prepare in advance for these new emerging threats. So global surveillance doesn't exist in any serious way today, and we need to build that. Second, we need to help individual national health systems to have that capacity to contain a new infectious disease outbreak. Because if you can't contain it nationally, it becomes international. And thirdly, very importantly, as we are learning from COVID, we need the manufacturing supply capacity for vaccines, treatments, testing equipment on a scale that is multiples larger than what we've seen so far. One of the reasons why we are 1.5 years into the crisis with such a small percentage of the global population vaccinated is we didn't have the capacity to supply vaccines. The next pandemic may or may not have a vaccine available, but we need either vaccines or treatments, and you need a whole set of other equipment, the testing equipment, the PPEs, the oxygen tanks, and you need to build that capacity before a pandemic, which is one of the key lessons of COVID. If you start only after a pandemic has broken out, it's going to take you a year or year and a half once again. And during that year and a half, you get mutations. And that's the most dangerous part of a pandemic. The longer it takes, the more mutations and the more everyone gets affected.
Yeah.